Hi, I'm Dr. Josh Jarvis, board certified radiologist, and welcome to my channel. So, what's a radiologist anyway? Let's find out together. Or, I guess, you'll find out. Pretty much. Stay tuned. See, told you the title sequence would make things look more legit. There's nobody over there. So welcome back. Again, I'm Dr. Josh Jarvis, radiologist, and essentially there are two reasons why I wanted to make this channel. One, I love my job, I love radiology, and I wanted to share that with as many people as possible. And two, not a lot of people know what a radiologist is or what we do. And it's that second point which I hope to address today. Now, I'll start by talking about a situation I find myself in from time to time. Occasionally my hair will grow and I'll find myself needing a haircut. Now, my wife offers to do it, but I don't trust her, so I end up going to some haircutting professional. And man, I just hate getting a haircut so much. The whole situation is just so incredibly awkward. You have some stranger touching your head, you don't know where you should be looking, they're cutting your bang, should I close my eyes? Is it weird if I close my eyes? If I'm good, will I get a sticker? You know, that sort of thing. And inevitably they'll start making some awkward small talk and ask me what I do. Now, I basically have two options. One, I can say I'm a doctor, which pretty much everyone understands, but I don't know, there's just something weird about that. For one, it's not very specific. Let's say you're a biologist or a chemist and you work in a lab or factory. You'd say, oh, I'm a biochemical engineer or whatever, not I'm a scientist. So, I don't know, that's not ideal. The other option is to tell them that I'm a radiologist, which almost universally they either won't know what that is or may think they know, but have some misconceptions. So that's basically why I wanted to do this video. So what is a radiologist? Well, most simply a radiologist is a medical doctor who specializes in the interpretation of medical images. Now, I think most people are vaguely aware of the different specialties in medicine. Dermatologist is a doctor who specializes in treating diseases of the skin. A surgeon is a doctor who specializes in cutting people open and fixing things on the inside. A pediatrician is a doctor who specializes in treating diseases in children. And in a lot of ways, a radiologist is really no different. We're simply doctors who specialize in looking at all the various medical pictures, x-rays, CTs, MRIs, that sort of thing. Let's take a common example. Let's say you get hurt doing, I don't know, what do you kids do today? You're playing kick the can, or chasing a big hoop down the dirt road with a stick, or riding one of those bikes with the big front wheel. No, obviously I'm joking, I'm not that old. So let's say you hurt your thumb playing Pong. You'll go to your family doctor, nurse practitioner, PA, whatever, and depending on how worried they are, they'll most likely order an x-ray. Well, nowadays, images are almost 100% digital. In the old days, they had physical films which you'd read by putting up on a Lightbox. In fact, the name of this channel is sort of a throwback to the good old days of radiology. In modern clinical practice, at least in the United States, it's extremely rare for radiologists to still read physical film. Since at least the mid to late 1990s, images have been obtained digitally and transferred to computer systems with super high quality monitors. Here's an example of a workstation at the place where I work. You can see there's a couple big monitors and the lights are kept low to increase visual acuity and minimize distracting glare. You know that scene in TV shows where a doctor slaps an x-ray film up on the Lightbox? Well, it might look kind of cool, it's just incredibly outdated. In fact, you probably wouldn't want to be seen at any of these TV hospitals where they haven't upgraded their radiology equipment in 20 plus years. So radiologists work in a variety of settings in hospitals and clinics, and thanks to digital imaging, they may be down the hall, across the street, across town, or even across the country. So getting back to our example, your images are sent electronically to a radiologist who looks at the images, interprets the findings, whether there's anything wrong, etc., and then creates a report, typically using voice recognition dictation software, which is then sent to the ordering clinician. Note that your family doctor, while able to access and view the images, isn't the one formulating the final imaging interpretation. That's the radiologist. In our subspecialized healthcare team model, it just doesn't make practical or patient care sense for them to do that. They simply don't have the training, which I'll discuss a little bit more. So, equipped with the interpretation from the radiologist, a treatment plan is then made. They'll put a cast or a splint on your thumb and send you on your way. So, in short, a radiologist is a medical doctor who, while you may never meet face-to-face, is there working in the background providing imaging diagnoses that can profoundly affect your overall care. Now, before I move on, I did want to quickly mention interventional radiology, which is a subspecialty of diagnostic radiology where they perform imaging-guided procedures. I'll do a dedicated interventional video sometime in the future. I also wanted to quickly mention what a radiologist isn't. A radiologist is not a radiology tech. These are the people who are producing the images for the radiologist to interpret. They're the ones taking the x-rays or running the CT scanner, and while techs are incredibly important, the skill set and training are just completely different. Radiologists also are not radiation oncologists. A radiation oncologist is a medical doctor who treats cancers with high-dose radiation. And while it probably goes without saying, radiologists don't work in nuclear power plants or with radioactive waste. So what kind of training is required to become a radiologist? Well, after high school, you need to get a 4-year undergraduate degree. That's a bachelor's degree in basically anything you want. Then 4 years of medical school, 1 year of internship, which is a general medicine or surgery year where you're taking care of patients in the hospital, that sort of thing. Then 4 years of general diagnostic radiology residency, and then most, I'd say, well above 90% of radiologists do an additional 1 to 2 year fellowship, which is further subspecializing in certain areas of the body or interventional radiology. So that's 14 to 15 years. That's a long time. Now, I'm putting up on the screen some comparisons with other medical specialties. This is the number of years of training required after medical school. And while this isn't an exhaustive list, and many of these can be longer if you choose to do additional fellowships, you can see that radiology has some of the longest, most extensive training of any of the specialties. So why does it take so long? Well, first you need to learn the anatomy. You need to know the imaging appearance of nearly every part of the body, including the parts of parts. Here, what's that? Or that? Or that? Oh, that's easy. That's the ulna. Yeah, but what's this part? Or this part? Or this part? Or these parts? Then you need to learn the imaging appearance of all these parts on all the different imaging modalities. This is a brain. This is a brain on non-contrast CT. This is a brain on MRI and all of its sequences. Here's a CT angiogram of the brain, CT perfusion, ultrasound of a baby brain, plain X-ray, that's not too helpful, conventional fluoroscopic angiogram, PET CT of the brain, SPECT, DAT scan, cysternogram, brain DET scan. Then you need to learn all the things that can go wrong with all the parts of the body, and what those problems look like on all the different types of imaging. What's that? Or that? Or that? Or this one? Lastly, you need to learn what all these different findings actually mean for the patient in a practical, clinical sense, so you can provide the best information for the ordering providers. Will they need to take them to surgery for this? Do they need any additional imaging to confirm or follow up? How worried should they be about those things in the liver? Basically, will management be changed in any meaningful way? So essentially, on top of all the imaging expertise, you need to know enough about all the different specialties that'll be ordering studies for you to read so you can provide the most valuable information to best help the patient. So now I'm going to make a potentially controversial statement that really shouldn't be that controversial. Radiologists are the best at radiology. Now, why would that be controversial? Well, medicine can be very tribal. Every specialty tends to think that they're the best and may even start to look down on the other specialties. And over time, specialists can become pretty good at reading studies within their own specialty. Experienced neurosurgeons can read a head CT or brain MRI. Orthopedic surgeons can get pretty good at reading knee MRIs. Emergency doctors can pick up on common fractures on X-ray. As these specialists become more comfortable with imaging in their own little area of expertise, it's not uncommon for them to start to think, why do we even need the radiologist anyway? I'm the shoulder or spine or whatever expert. I do all the surgeries. I know all the anatomy. I can read these studies just as well. Why should the radiologist get paid to do something I can do myself? Well, that's all well and good for the 90% of studies that are straightforward, but what about the 10% that are confusing, subtle, or just straight up weird? Now, obviously this is where training comes in. It's not enough to simply look at a bunch of studies and become familiar with the common things. You also need to know about the things you might only see once or twice in your life, and the things that are super easy to overlook, as well as all the technical aspects of imaging which can complicate interpretation. The required formal radiology training for specialties outside of radiology ranges from none to minimal. A lot of medical schools don't even have a required radiology rotation, and there really isn't a ton of time during residency to focus on areas outside of your chosen specialty. I mean, it makes sense. It's hard enough learning to be a surgeon or neurologist or whatever without spending a bunch of time on something else. So, best case scenario, you do a 4-week elective in medical school and maybe another elective or 2 in residency, which these electives often aren't the greatest just given the steep learning curve in radiology. It's a lot of sitting and watching and maybe learning some extremely basic concepts. So, maybe they get 8 to 12 weeks of formal training. Compare that with the 260 weeks of training for a radiologist. There's just simply no comparison. I guess all I'm trying to say is that medicine, when done right, should be a team sport, and that it's not terribly unreasonable to let the people who've trained become experts do their job. I rotated through OBGYN during med school and I caught a few babies. I probably have more formal training in delivering babies than a lot of physicians and other specialties have in radiology. So maybe instead of just reading prenatal ultrasounds, I should pick up some side work delivering babies. After a few normal or otherwise uncomplicated deliveries, maybe I might feel pretty good about the whole thing. But let me tell you, if something starts to go wrong, you definitely do not want me running that show. I just don't have the training to deal with any potential problems that might come up. And worse, I might not even realize that there's anything wrong at all. Non-radiologists practicing radiology is just as absurd and potentially dangerous. Anyway, I'll stop ranting and just suggest that maybe the next time you're a patient receive imaging, you ask your provider if a radiologist has looked at your study, and make a habit of requesting or otherwise looking up the final reports from the radiologist to make sure that things make sense for whatever you are being seen for. And if not, ask your provider to clarify. And if for some reason they can't, radiologists are always available to speak with patients about findings, because when it comes to the pictures, we're your doctors too. So hopefully all this sheds some light on who radiologists are and what we do. We're doctors, often working behind the scenes who you might not get to meet face to face, but the care we provide in image interpretation often has powerful effects on your medical care. And thanks again for watching and welcome to my channel. I think we're going to have a lot of fun and maybe learn a few things along the way. Radiology is just so awesome, you guys. So make sure you like, comment, and subscribe, and look forward to my next videos, 2 of which are available right now. Boom! Radiology entertainment bomb right off the bat. Editor, can you add like an explosion graphic and No, that's... never mind. So go watch those videos and learn about X-rays and CTs. It's going to be awesome. I'll see you next time. If you got slick production values, content doesn't really matter.